Dr. Whitfield doesn't need to schedule a family meeting, my brother Todd said, rolling his eyes so hard I could hear it in his voice through the phone. This is so dramatic, Kayla. Mom's fine. She's always fine. I sat in the parking lot of Riverside Cardiology, staring at the appointment confirmation on my phone. Friday, 2 p.m. Family Care Conference, Margaret Boone, and felt something cold settle into my chest. Cardiologists don't call emergency family meetings for patients who are fine. I'd been telling Todd and our sister Priscilla that for 3 years. I'd been sending them lab results, printed after-visit summaries, screenshots of Mom's blood pressure readings that read like a countdown clock. And for 3 years, they'd told me I was overreacting. They don't call a meeting for nothing, I said. This is Dr. Nadia Farouk. She's not the dramatic type. Well, I've got the Fletcher deposition Friday, Todd said. Can't you just handle it and tell us what she says? I'd been handling it for 3 years, handling Mom's 12 medications, handling her missed dialysis education appointments before she progressed to needing dialysis at all, handling the diabetic diet she refused to follow when nobody but me was watching her plate. And in 3 days, I was about to walk into a room and hear something that would prove, in the coldest, most clinical terms possible, that every warning I'd relayed to my siblings over 3 years hadn't been dramatic at all. It had been real, and it had been ignored. Backstory set up. My name is Kayla Boone. I'm 39 years old, and I work as a physical therapist at an outpatient clinic in Wichita, Kansas. I'm married to my husband Derek, and we have 2 kids, Aiden and Sophia, 11 and 8, whose lives, looking back, absorbed more collateral damage from these past 3 years than I fully realized while I was living through it. My mother, Margaret Boone, was 68 when the warning signs first started, and my father had passed away back in 2017 from a heart attack, which is a detail that matters more than it might seem, because it meant Mom had been managing her own health entirely alone for years before any of us really understood how poorly she was doing it. I have 2 siblings. Todd, 43, is an attorney at a mid-sized firm, married to a woman named Lisa, with no kids, living about 25 minutes from Mom. Priscilla, 35, works in hospital administration and lives 4 hours away in Kansas City, married with 1 toddler, always citing distance as her primary reason for limited involvement. The warning signs started around 2022. Mom had been diagnosed with type 2 diabetes back in 2015, well managed for years with metformin and diet, but around 2022, her primary care doctor, Dr. Amina Rashid, started flagging concerning numbers, an A1C that had crept from 6.8 to 8.9 over 18 months. Blood pressure readings consistently above 150/95, despite medication, and early signs of proteinuria on routine blood work that suggested her kidneys were beginning to struggle. I want to be clear about something. None of us decided I would be the one managing this. There was no conversation, no agreement, no division of labor discussed at a kitchen table. What happened instead was that I lived closest, I asked the most questions at appointments, and slowly, without anyone ever saying so directly, every doctor's office, every pharmacy, every lab result started routing itself through me. It started with me simply attending appointments with Mom because she asked me to, since Dad had always been the one who handled the doctor talk, and she felt lost without him there. Then it became me calling to schedule those appointments, because Mom would let months slip by. Since I feel fine, don't worry about it. Then it became me managing her pill organizer, because I discovered, almost by accident, that she'd been taking her lisinopril inconsistently for months, sometimes doubling up when she remembered she'd missed days, which is dangerous with a blood pressure medication. By 2023, I was driving to Mom's house 2 to 3 times a week, checking her blood sugar logs, which she filled out inconsistently at best, cooking meals that fit her diabetic diet, because left alone, she'd eat the way she always had, biscuits and gravy, sweet tea, the comfort food she'd grown up on in rural Kansas, and never fully let go of, despite every warning from every doctor she'd seen. I started sending updates to the family group text after every appointment, Partly to keep everyone informed, partly, I think now, because some part of me was hoping someone would step in and say, "Let me take this one, you've got enough on your plate." Me, March 2023, Mom's A1C is up to 8.9. Dr. Rashid wants to add a second diabetes medication and is concerned about her kidneys. I'm going to start managing her meal prep more closely. Todd, yikes, hope she gets it together. Let me know if you need anything. That's concerning. I wish I was closer. This is so hard from 4 hours away. Let me know if you need anything. And, I wish I was closer, became the twin refrains of the next 2 years. Phrases that sounded like concern, but functioned as permission slips for continued absence. By mid-2023, I had reduced my hours at the clinic from full-time to a 0.75 schedule, costing me roughly $9,500 a year in lost income, specifically so I could accompany Mom to what became a growing list of specialist appointments: nephrology for her declining kidney function, cardiology once an echocardiogram revealed early signs of left ventricular hypertrophy from years of poorly controlled hypertension, and ophthalmology for diabetic retinopathy that had begun affecting her vision. I paid for a lot of this out of pocket beyond just lost wages. A blood pressure monitor with data logging capability that cost $140, a continuous glucose monitor sensor system that insurance only partially covered, running me about $65 a month in supplemental costs, and eventually, a part-time home health aide twice a week at $23 an hour once Mom's mobility started declining alongside everything else. Every single lab result, every concerning number, every doctor's warning, I relayed faithfully to Todd and Priscilla, and every single time, the response was some version of minimization. She's always been dramatic about her health. Mom's tough, she'll be fine. You worry more than the doctors do, Kayla, honestly. I remember one specific moment in September 2023 that should have been a turning point but wasn't. Dr. Rashid sat Mom and me down and said, plainly, "Margaret, your kidney function has declined enough that I need to refer you to a nephrologist for staging. Your GFR is down to 42. If this trend continues, we're looking at chronic kidney disease progression that could eventually require dialysis." I relayed this, word for word, to the group chat. Todd's response: "Well, that sounds serious, but doctors always frame things worst case. I'm sure it'll be fine with some diet changes." Priscilla didn't respond to that message at all for 4 days. Nobody came to the nephrology appointment except me. Nobody came to the cardiology appointment except me. Nobody came to a single ophthalmology visit, a single dietitian consultation, a single one of what became, by 2024, nearly monthly medical appointments, except me, taking time off work, rearranging my kids' schedules, asking Derek to cover pickups and drop-offs so often that he started, gently, asking when this was going to level off. "I don't know," I told him honestly, more than once. "I think it gets worse before it gets better, if it gets better at all." Rising conflict. The moment that changed everything happened in February 2025, on a Sunday morning, when Mom called me sounding confused, slurring slightly, saying she felt fuzzy, and that her chest felt tight. I called 911 immediately and met the ambulance at her house. By the time we got to Ascension Via Christi, her blood pressure was reading 210/120, a hypertensive crisis, the ER physician said, compounded by blood glucose readings over 400, dangerously uncontrolled. They ran troponin levels, worried about a possible cardiac event, and admitted her to the ICU for close monitoring. I texted the group chat immediately. "Mom's in the ICU. Hypertensive crisis. Blood sugar over 400. They're checking for a heart attack. This is serious. I need help." Todd responded 3 hours later. "Oh no, that's scary. Keep us posted, I've got a trial starting Monday and I'm buried in prep." Priscilla called that evening, finally, her voice tight with what sounded more like inconvenience than fear. "I can maybe come next weekend if things are still bad. It's just really hard to get away with Emmy being so little." Nobody came. Not that day, not the next. I sat in that ICU for 3 days, sleeping in intervals in a vinyl recliner, missing an entire week of clinic hours, calling Derek each night to check on Aiden and Sophia, translating medical terminology for Mom when she woke up frightened and disoriented, advocating fiercely when I felt the nephrology consult was taking too long to materialize, given her declining kidney function, combined with the crisis blood pressure. The troponin levels came back elevated enough that the cardiologist, Dr. Nadia Farouk, diagnosed a type 2 winistemi, a heart attack caused by mismatch between oxygen supply and demand, rather than a blocked artery, but a heart attack nonetheless. Directly connected, she explained, to years of poorly controlled blood pressure and diabetes finally catching up with Mom's cardiovascular system. When Mom was finally stabilized and discharged 5 days later, needing an entirely restructured medication regimen, closer monitoring, and likely a dialysis referral within the coming year given how far her kidney function had fallen, I called Todd directly, exhausted past the point of politeness. "I need real help," I said, "not sympathy texts. I need someone to take some of these appointments, or contribute financially to the 8 hours I'm going to need to add. I cannot keep doing every single piece of this alone." There was a pause, and then Todd said the words that still echo in my head months later. "Kayla, look, nobody asked you to become her full-time medical manager. You've always been the one who takes charge of things. That's just who you are. I'm not going to feel guilty because you decided to handle everything yourself." "I didn't decide," I said, my voice shaking. "I was the only one paying attention." "That's not fair," he said. "You have no right to guilt-trip us for having our own lives, Kayla." I sat in my car in the hospital parking garage after that call, gripping the wheel, feeling something inside me crack that had been holding steady for nearly 3 years. By that point, I calculated, because by then I'd started keeping meticulous records, some instinct from my clinical training kicking in, that I had spent just over $18,000 of my own money across aid wages, medical equipment, supplemental costs insurance didn't cover, and the cumulative lost income from reduced work hours. Todd and Priscilla's combined financial contribution over 3 years, 0. Their combined hours of direct caregiving, I could count them on one hand, and yet, whenever I mentioned needing help, the response was some variation of the same theme. I had chosen this, therefore I had no right to complain about its cost. Climax-betrayal reveal Mom's health continued a slow, frightening decline over the following months. By June 2025, her GFR had dropped to 24, squarely in stage 4 chronic kidney disease territory, and Dr. Farouk was managing her cardiac function with a growing medication list that required careful monitoring for interactions with her worsening kidney function. A delicate, exhausting balancing act that fell, as everything had, to me. It was around this time that Todd's interest in Mom's situation shifted, suddenly and unmistakably, toward a subject he'd shown no curiosity about in 3 years, her finances. He called me in July, and within minutes of surface-level small talk, pivoted sharply. "So I've been thinking," he said, "Mom's house has to be worth what? $310,000 now? And she's got that old pension from Dad's railroad job. We should probably start thinking about how things are structured, make sure everything's fair for all 3 of us down the road." "Fair?" I repeated. "Todd, I've spent almost $20,000 of my own money on her care. I've cut my work hours by a quarter for 3 years. I'm not sure fair means an even split at this point." "She's my mother too," Todd said, an edge creeping into his voice. "I'm not saying you haven't done a lot, but that doesn't mean you get to control the estate conversation. Priscilla and I both have equal claims here, legally." I remember feeling something go cold in my chest, the same feeling I'd had staring at that appointment confirmation months earlier. "You haven't been to a single appointment in 3 years, Todd. Not one." "That's not the point," he said. "You wanted to be the one who handled things. Don't act shocked, now that there's a conversation about what happens with what's left." Then, 3 weeks later, came the moment that still makes my hands shake when I think about it. Priscilla, of all people, sent a message to the family group chat that read, "I've been talking to Todd, And honestly, we're both a little concerned about how much control Kayla has over Mom's finances and medical decisions at this point. Kayla has power of attorney, handles all the accounts, and none of us really have visibility into what's happening. We think we should look into getting an independent review, just to make sure everything's being handled appropriately. I stared at that message for a long time before I could even process it. They were suggesting, in writing, in a family group chat, that my 3 years of unpaid, unassisted, exhausting caregiving might actually constitute some kind of financial impropriety, requiring independent review. Me, the one who had spent nearly $20,000 of my own money, the one who had reduced my work hours, missed my own children's events, sat through ICU nights alone, learned every medication interaction relevant to stage 4 kidney disease, and relayed every single warning sign for 3 straight years to 2 siblings who had dismissed every one of them as dramatic. "You have no right to question how I've managed this," I said, calling Todd directly, my voice breaking with a fury I'd never felt toward my own brother. "I have every receipt, every appointment note, every message where I told you both exactly how serious this was getting, and you both told me I was overreacting." "That's exactly what someone would say if they wanted to avoid scrutiny," Todd replied, and something in that sentence, the casual, lawyerly coldness of it, broke something in me completely. Turn, twist. I want to tell you I fell apart. I did, for about a day, and then something in me went quiet and focused, the way it does clinically when a patient crashes and there's no time left for panic. I didn't need to hire an outside investigator to build my case, because it turned out one already existed. Dr. Nadia Farouk, Mom's cardiologist, had been watching this family dynamic unfold for months, and she was the one who ultimately called the meeting that started this whole story. 2 days after Todd's accusation, I received notice of a scheduled family care conference, and I walked in with something Todd and Priscilla had no idea existed: 3 years of documentation. I had every after-visit summary from every appointment, going back to 2022, showing precisely who had attended each one. Overwhelmingly, almost exclusively, me. I had every text message where I'd relayed lab results and doctor warnings to my siblings, time-stamped, alongside their dismissive responses, creating an unbroken record of warnings given and warnings ignored. I had every receipt for aid wages, medical equipment, and supplemental costs, totaling $18,400, paid from my personal account, never once reimbursed. I had bank statements for Mom's own accounts, which I managed under a financial power of attorney executed in early 2024, showing money flowing appropriately toward her care, with 0 irregularities, 0 unexplained withdrawals, 0 evidence of anything remotely resembling the impropriety Todd and Priscilla had implied. Dr. Farouk had called this meeting not because of any family financial dispute, but because Mom's condition had reached a point requiring a serious conversation about dialysis initiation, and she wanted the entire family present to understand the medical reality. But when Todd, in that meeting, tried once more to suggest that perhaps decisions had been made without appropriate family input, Dr. Farouk did something I will never forget. She looked at him directly and said, "Mr. Boone, I want to be very clear about something. Over the past 3 years, I have had exactly 1 family member attend appointments, respond to urgent calls, manage medication reconciliation, and advocate consistently for your mother's care. That has been Kayla. I have chart notes documenting warnings given to this family as early as 2022 regarding declining kidney function, warnings that, according to Kayla's own records and my own recollection, were relayed to both of you and not acted upon. If there's a question of who has acted in Margaret's best interest here, the medical record answers that question unambiguously." The room went silent. Priscilla's face had gone pale. Then Mom spoke. She'd been quiet through most of the meeting, tired from the visit, but she straightened in her chair and said, with more clarity than I'd heard from her in months, "I want to say something. Kayla has been at every single appointment. Everyone. I don't remember the last time either of you drove me anywhere or sat with me through anything hard. If there's an inheritance conversation happening, I already know what I think is fair, and I've already told my lawyer as much. Todd started to speak, but Mom held up her hand. I'm not finished. I let this go on too long, watching you two treat Kayla's sacrifices like they were nothing. Like she was just being dramatic when she told you how sick I was getting. That ends today. Resolution: Mom began dialysis 3 times a week that following month. A hard adjustment, but one she's managed, so far, with more resilience than any of us expected. Her cardiac function has stabilized under Dr. Farouk's careful management, and while her overall health remains fragile, she's alive, she's engaged, and she's clear-eyed in a way she hadn't been in years about who had actually shown up for her. 2 weeks after that meeting, Mom updated her estate plan with her attorney, allocating a significantly larger share to me in direct recognition. The document states, of the care, sacrifice, and consistent presence provided by my daughter Kayla, without which my health outcomes over the past 3 years would have been substantially worse. Todd didn't contest it. I think, on some level, he knew he couldn't. Not with 3 years of documented warnings, sitting in a medical chart with his name attached to every dismissal. Priscilla called me a month later, her voice quieter than I'd heard it in years. I think I told myself the distance was a real excuse, because it was easier than admitting I just didn't want to face how sick Mom was getting, she said. I'm sorry, Kayla. I don't know if that means anything at this point, but I am. I appreciated it, even if it came far too late to change what those 3 years actually cost me. When I think about everything, the $1,400 spent from my own pocket, the reduced work hours, the missed school events, the nights in hospital recliners, the years of relaying warnings that were met with, "You're being dramatic," until a doctor herself had to convene a meeting to force my family to listen. I don't think about it in terms of vindication anymore. I think about how close we came to losing Mom entirely, to a family's collective decision to look away from what was right in front of them. If you're the one sending the lab results nobody reads, relaying the warnings nobody heeds, sitting alone in waiting rooms while your siblings say they wish they could be there, keep every record, every message, every appointment note, not because you'll necessarily need to defend yourself, though you might, but because eventually, someone with a medical degree, and no stake in the family politics, may be the only person who says, out loud and on the record, what you've been trying to tell everyone all along, that you were never being dramatic, you were just the only one paying attention.